Hello, good evening. My name is Dr. Charlotte. I'm a board certified pediatric ophthalmologist and billing and coding specialist. I'm here for the billing and coding update, and I'm here to share strategies to help you make sure that you do not get audited, or if you do get audited, you pass with flying colors, and also that you've learned to bill and code accurately so you can receive the compensation that you deserve. Today I'd like to talk about the review of systems. What is the review of systems, first of all? Well, we've talked about the evaluation and management services exam and the elements you have to have. One, the chief complaint, being why a person comes to you, the history of present illness, and then some other documentation you have to include to make sure that you are documenting properly and you are able to support the level of documentation that you want to charge the patient or the insurance company. So I want to focus today on the review of systems. So the review of systems is when someone has a chief complaint, but you want to find out if that chief complaint affects the other body system. So I'll give you an example. I'm an ophthalmologist, and someone could come and say, hey, my vision's blurry. Well, I'd like to know, is there anything else going on when the patient's vision is blurry? One of the constitutional number one review of systems, you would ask if they had fevers, chills, weight loss. So let me use my cheat sheet here and share the review of systems with you. Constitutional, you often ask about weight loss or fatigue. The eyes has its own review of systems, blurry, double. Ear, nose, and throats have its own review of systems, earaches, hearing problems. Cardiovascular system has its own review of systems, chest pain, palpitations, respiratory, wheezing, shortness of breath, GI, abdominal pain, constipation, urinary, bloody urine, no urine, skin, rashes, neurological, seizures, headaches, psychiatric, anxiety, depression. So basically, review of systems is reviewing what other symptoms that follow in this certain class that deals with the person's a visual complaint. So if somebody told me, well, my vision's blurry, but I also have I've been urinating frequently, I have been, my mouth has been thirsty, that would make me think, well, maybe the person has some sort of, maybe they have diabetic retinopathy, that's why their vision's blurry. But I digress. The reason why I wanted to discuss the review of systems is that the extent of your review of systems can determine the level of billing that you can do. So a level 3 is and a level 4. A level 3 has to have an extended review of systems, and a level 4 exam has to have a comprehensive review of systems. Well, what is the difference between an extended review of systems and a comprehensive review of systems? The extended, you have to review 6 of those organ systems. For a comprehensive review of systems, you have to review 10 of those review of systems. So I'm an ophthalmologist. I'm sometimes lucky I don't choose to bill E&M codes. I will omit my review of systems and bill I codes. But for everybody who uses E&M codes, the difference between a level 3 and a level 4 is an extended review of systems and a comprehensive review of systems. So why do I focus on the review of systems? Because that area, especially with electronic medical records, it is a big area of auditing. So they want to know, well, did you really ask that patient the review of systems? Or are you just clicking your clicker and then everything is normal? So one thing, how I kind of combat that cloning that the auditors are trying to accuse you of in review of systems is to actually have the patient fill out a review of systems form. So if I want to bill the highest level, if the patient comes in and their vision's blurry and they have diabetic retinopathy and I need to offer a treatment, that is a level 4. That is some serious medical problem. But if I don't take the adequate review of systems, I would have to down code it to a level 3. So I have the patient fill out a review of systems form that is the same as the one in my EMR. So if they say, well, did you just click everything? No. And or did you just change a few things? I say, no, look, I actually have it in my patient's own handwriting, and you can see it in my EMR that they actually filled out the form, and all I was doing was transcribing. So that is one thing to do to help prevent you from being from losing the audit on the review of systems. So the difference between a level 3 and a level 4. Level 3, you go to most doctors should be able to bill a level 3. Those are often for low decision-making problems, self-limiting problems. But if somebody has a level 4 problem, like the diabetic retinopathy that needs to be treated, then we need to make sure that we're documenting accurately that those 10 review of systems, so you can get paid for level 4 instead of down coding for the level 3. So the reason why I chose the review of systems is because that's where you can really be caught on the audit. And one way to combat being caught on the audit is having the patient fill out a review of systems that is similar to your EMR template. If you're lucky to design your own EMR, maybe you can have the patient fill out the review system on the tablet, and then it automatically goes into your system. But if you do the work, especially if you have the medical decision making, the complexity of the medical decision making to bill a level 4, you need to have your review of systems, your 10 review of systems, to make sure that you are able to bill a level 4. Last week, I think I discussed a little bit about, CMS changing the rules, but in the meantime, you need to document appropriately. The CMS has had something they call RAC audits, where they go and contact Medicare providers and they go and examine their review of systems. And the biggest one they try to catch people on is cloning. So how do you prevent cloning? You make sure that you maybe have the patient fill out the form that you're putting in the computer, making sure it's not the same every time. So if somebody comes for a follow-up visit, a review of systems may not be required, so you do not carry that forward. But on the initial visit, a lot of times that you can bill a level 4 to bill the level 4 code for a new patient visit. You need a comprehensive review of systems that is 10 organ systems included, that are that you ask the patient if that's been going on in their life, in addition to your history of present illness, your past medical history, your past surgical history, your family history. So that is just really important. But the reason why I decided to discuss review of systems today was because that's an area, the frequent area of cloning, and then the government wants their money back between a level 4 and maybe even a level 2, because a review of systems in the level 2 actually only has to be about that one organ system that the person is complaining about. So even to document a level 3, you need to make sure that you have 6 of the organ systems documented in the review of systems. So one thing that would be a limiting self-limiting, low decision-making problem in my field as an ophthalmologist is chalazion. What's a chalazion? It's a clogged oil gland. The patient has a big bump on the eye. They call it painful, but sometimes they'll go away by themselves. The treatment is very simple, a warm compress. But if I would want to build that as an E&M code and have a level 3 because it was a low decision making to tell the patient to use the warm compresses, I still need to include maybe the respiratory review of systems, the cardiovascular review of systems, the skin review of systems, the constitutional review of systems, the urological review of systems, or the GI review of systems. They all may be negative, but I have to document that I did ask them, and I kind of use that paper review of systems as an extra insurance policy. So I have the review of systems listed. If the patient has none, they just circle none, but if something is bothering them, they check that box. So, and then I have my staff member go, and the review of systems form corresponds to what they filled out. So if they say, hey, Dr. Acor, you know, this looks like cloning, because I have young, healthy kids. Most of the time, they don't have any of those problems. I said, hey, here is in my chart. This is what the parents filled out. They did not complain of any of these problems. They did not complain of chest pain. They did not complain of earache. All they're complaining is the bump on their eye. It's painful, and that's what I need to do for it. But I do have my 6 review of systems to document that that patient has, you know, a level 3 new patient exam. So I get paid appropriately for my work. So again, my name is Dr. Charlotte Acor. I'm a board certified pediatric ophthalmologist and billing and coding specialist. I enjoy making sure that young physicians and you know, even experienced physicians are obtaining the compensation they should get, and making sure they're documenting correctly. Please tune in on Tuesdays here on my Facebook page for billing and coding update. Have a blessed evening. Goodbye.